You gather the strength to get help for your addiction, but the anxiety won't let you breathe. You go to therapy for your depression, but the drinking gets worse. It's like fighting two battles at once, with half the armor. This is the brutal reality of dual diagnosis, when mental health disorders and substance use collide. Today, we will be discussing all you need to know about concurrent disorders. What is dual diagnosis? Dual diagnosis, also known as co-occurring disorders, refers to when a person experiences both a mental health disorder and a substance use disorder at the same time, and it's far more common than often discussed. Over 9 million people live with a dual diagnosis in North America alone. Depression, anxiety, PTSD, bipolar disorder, paired with alcohol, opioids, stimulants, or other substances. It's not one or the other. It's both, overlapping and feeding off each other like a toxic cycle. So why do these conditions show up together? It's not a coincidence. It's a survival strategy gone wrong. Someone with untreated anxiety may turn to alcohol to calm down. A person with ADHD might misuse stimulants to focus. Someone with trauma may try to numb memories with opioids. And then the substance use starts changing the brain, worsening the very symptoms it was supposed to help. It becomes a trap. You drink to forget the pain. The drinking causes more pain. You drink again. Let's break this down with the story of Jay. Jay started using pills in college to manage panic attacks he couldn't explain. Eventually, the pills took over, and he dropped out. He tried therapy, but was told he needed to get clean first. He went to rehab, but no one asked him about his panic. After 6 relapses, Jay finally got into an integrated dual diagnosis program. It was the first time someone treated both his pain and his addiction. That's when recovery truly began. Jay's story isn't rare, it's just rarely told. Why is dual diagnosis hard to treat? Treating co-occurring disorders is extremely complex. Most traditional systems treat mental health and addiction as separate problems. In dual diagnosis, you can't treat just one and expect recovery. Treat the depression, but ignore the addiction. Relapse happens. Treat the addiction, but ignore the trauma. The symptoms come back stronger. Integrated treatment is the gold standard. That means addressing both conditions at the same time, using a single unified care plan, and having therapists and addiction counselors work together. But finding this kind of care isn't always easy. Many people fall through the cracks. So what can you do if you or a loved one is suspected of experiencing a dual diagnosis? Step 1. Recognize warning signs. Pay attention to changes in mood, thinking, or behavior alongside changes in drug or alcohol use. Watch for substance use signals like withdrawal symptoms, high tolerance, cravings, spending a lot of time using, or risky behavior to obtain substances. Look for mental health signs like extreme mood swings, anxiety, paranoia, confusion, social withdrawal, irritability, or suicidal thoughts. Keeping a journal of symptoms and triggers can help you spot patterns, such as feeling suicidal after heavy drinking. Early recognition, or noticing a loved one's sudden changes, is key to getting timely help. Step 2. Seek a professional evaluation. Once you suspect a dual diagnosis, reach out to a healthcare provider promptly. Doctors and counselors now routinely use standardized screening tools for both mental health and substance use to identify co-occurring issues. Explain all your symptoms and substance use honestly, even if you feel embarrassed. If possible, bring a friend or family member who knows your history to appointments. You can also call a confidential helpline, like SAMHSA's National Helpline, or visit samhsas findtreatment.gov to locate dual diagnosis services in your area. Professional evaluation may involve questionnaires, interviews, or tests to clarify whether you have one or multiple disorders. Trust that an integrated assessment covering both aspects will give the clearest picture of what's going on. Step 3. Seek integrated care. Treatment that addresses both the mental illness and the substance use together. Current best practices emphasize integrated intervention where doctors treat all conditions in concert. For example, a psychiatrist and an addiction counselor may collaborate, or you may enter a program specialized in dual diagnosis. Treatment plans are personalized. They often include therapy, such as dialectical therapy, medication for mental illness or to ease withdrawal, and support services like social work or peer support. If one provider focuses only on your mental health while ignoring the substance use, or vice versa, ask explicitly for referrals to a dual diagnosis program or specialist. In inpatient settings, be clear that both issues matter. For instance, tell the doctor your depression worsens when you drink. Remember, treating co-occurring disorders as one holistic problem leads to better outcomes. Step 4. Communicate openly with providers and loved ones. In appointments, be candid and thorough. Before the visit, make notes of recent symptoms, substance use history, including types, amounts, and frequency, and any questions. Start appointments by saying something like, "I've been feeling anxious, depressed, and I also use alcohol or drugs," so the provider knows to consider both. Describe how your symptoms overlap, for example. "I drink to cope with my depression, but then I feel worse." Ask direct questions, such as, "Could my drug use be linked to these feelings?" If needed, bring a family member or close friend with permission, who can add details or help you remember. The key is honesty. Concealing aspects of either condition can hinder proper treatment. Clinicians are trained to handle dual diagnoses, so don't hesitate to discuss all issues. It may also help to write down the provider's instructions or record the conversation with permission, since treatments can be complex. Throughout this process, keep asking for clarification until you feel understood. Loved ones can help monitor symptoms, remind you of appointments or medication, and offer encouragement. If you feel comfortable, educate them on co-occurring disorders, for example, NAMI's family-to-family programs. You might also invite a family member to join a therapy session or attend a support group together. Peer support can reduce stigma and isolation. Attending family support meetings can help loved ones learn how to support you. For example, NAMI offers free peer-led family support groups nationwide for those coping with a loved one's mental health issues, often including addiction concerns. These groups provide a safe place to share experiences and resources. Connecting with peers who understand dual diagnosis can provide ongoing encouragement and practical advice. Here are some reputable, free groups and forums, many of which have online meetings or message boards. Number 1. Double Trouble in Recovery, or DTR, is a 12-step fellowship for people with both a mental illness and a substance use disorder. Members share experience, strength, and hope on dual recovery. You can visit dtr.org or contact NAMI for more information. Number 2. Dual Recovery Anonymous, or DRA, is an independent 12-step fellowship for dually diagnosed individuals. It has meetings worldwide, many of which are online, specifically for concurrent mental health and addiction recovery. Number 3. Dual Diagnosis. Anonymous, or DDA, is a free 12-step program designed for people coping with co-occurring mental health and substance issues. DDA follows a 12 steps plus 5 recovery program and offers meetings online. Number 4. Alcoholics Anonymous, or AA, is the classic 12-step fellowship for alcohol addiction. AA is free and widely available. Many groups welcome members with mental health concerns. Number 5. Narcotics Anonymous, or NA, is similar to AA but focused on drug addiction. NA groups are free and global. Look for meetings that are comfortable discussing mental health. Number 6. Smart Recovery is a secular, science-based support group, available both online and in person for all kinds of addiction. SMART uses cognitive and behavioral tools and runs a free online community. Number 7. The National Alliance on Mental Illness, or NAMI, offers local and online support groups and education for people with mental illness and their families. NAMI-run groups are peer-led and no cost. You can use NAMI's Find Your Local NAMI tool at nami.org. Many affiliates now cover co-occurring issues. Number 8. The Depression and Bipolar Support Alliance, or DBSA, provides free online support groups and forums for people with mood disorders like depression and bipolar. While focused on mood, members often discuss substance use issues too. Visit dbsalience.org for more information. Number 9. In the Rooms is a free global online recovery community with live meetings and chat rooms for addictions and mental health. They host meetings for many fellowships like AA, NA, SMART, and have forums on dual diagnosis. Number 10. Al-Anon family groups offer free support groups for people concerned about someone with a drinking problem. This can be helpful for family and friends of those with co-occurring disorders. Visit al-anon.org for more details. Number 11. Nar-Anon family groups provide free support for family and friends of addicts. This is useful if a loved one's drug use is involved. Check out nar-anon.org for more information. Online forums like soberrecovery.com, which focuses on substance issues, or mentalhealthforum.net, have active message boards on dual diagnosis topics. You can post and browse threads on mental health and substance recovery, but always check forum policies and anonymity options. These groups are generally free and run by peers. Attending meetings, even online, can reduce isolation, provide coping tips, and connect you to resources. Always verify meeting times and access requirements on the group websites. If you or someone you love is dealing with a dual diagnosis, don't let shame stop you from reaching out. Ask if the program or provider treats co-occurring disorders. Build a support team, therapist, doctor, sponsor, peer group. And remember, don't expect quick fixes. This is a marathon, not a sprint. Not a healing is possible, even if it's messy, slow, and painful. There are people who care, programs that work, and hope that's real. Dual diagnosis isn't a death sentence. It's a complex, painful reality, but also a battle that can be won with the right support. Let's stop separating mental health and addiction. Let's treat the whole person, not just their symptoms. And let's never forget, behind every addiction, behind every diagnosis, there is a human being, worthy of love, healing, and a second chance. Don't forget to like and subscribe to our channel. Together we can break the stigma surrounding mental health.